Welcome to Your Truth Revealed, a video podcast that explores your hidden physical and mental health potential. I'm Erika Marcoux, and I share with you the power of self-knowledge. I interview industry professionals to talk about how you can be your own health expert. You're watching episode 14, Know Your Pain. This is the second part of an interview with physical therapist Rachel Palmer. We explain what pain actually is and practical ways to alleviate it. Rachel Palmer has a Bachelor of Science in Kinesiology and her doctorate in physical therapy from Mount St. Joseph University. She's a physical therapist with Baylor Scott White Institute for Rehabilitation.
Do you have nerves that go to all parts of your body? It's just this really good communication system to, your central database, like your brain. Mm-hmm. So everything's getting on the same page.
Listen as we dive into the aspects of pain that can lead to better health. There are 3 types of pain that are acute, chronic, and neuropathic pain. Mm-hmm. Can you explain those 3 types of pain in a little more detail?
Acute pain usually lasts around 3 to 6 months. I'm going to just use this ankle sprain example forever.
Okay. It works.
You have the sprain, you have the increased blood flow to the area with the nutrients that kind of help heal everything. The muscles that guard around it to protect it, they're a little bit tight, but over time, then they kind of calm down and it kind of works itself out. From 3 to 6 months, then you're totally back to normal.
That's the kind of pain we want.
That's
right?
That's the kind of there's an injury, it gets addressed, and it goes away. Chronic pain is the pain that will linger on past that 6-month mark. Mm-hmm. And that tends to happen a lot more whenever those byproducts and that muscle guarding and everything that doesn't calm down and it gets stuck in that cycle. With chronic pain, even after that issue is resolved, the initial injury, then sometimes, even though when that's healed, the other muscles in the area, they still get stuck in that cycle and they don't calm down.
So they don't know yet that everything's okay with the injury. They're still overcompensating.
Right. They don't know to turn off. So that's very uncomfortable for people, especially since that when these chemicals kind of hang around in that area, it sensitizes all of those pain receptors. When you experience a painful stimulus, those receptors pick up on that, and once they get so much of that input, then they hit that threshold. So they reach that threshold extremely easily, and so they are sending that pain signal way more often. And then the more that pain signal is sent, the more the muscles will guard, the more pain it's this crazy cycle. It's hard to break out of. And a lot of times with people with chronic pain, some recent studies have found, I've looked at people with MRIs and looked at their brains. And so let's say that someone with chronic back pain, not only are those receptors that are going to their area in their brain that are correlated with their back are firing, but also the emotional centers in their brain are firing as well.
So this is where we get to the physical pain also causing emotional pain.
Yes.
Like anxiety or depression, how closely those are linked.
Yeah.
And they have the MRI scans to prove it.
Right, exactly. Wow. And not only does it activate those centers, it actually makes those emotional centers become like bigger for that neuroplasticity, because they're being activated more often. Those areas will become larger in the brain. So then
poor us.
I know. I mean,
that's rough.
It can be terrible for chronic pain patients. And it's just really tough too, because it's something that you can't always see, So it can be hard for other people to sympathize or empathize with you, because because
you look fine.
You look fine, right? You look fine. You must be fine. What's wrong with you? Why
You're just
are you
complaining?
Right, exactly.
And the opioid addiction can also have an emotional impact, impacting lifestyle, relationships. And then what can happen in that cycle is that your tolerance just becomes higher and higher. Right?
Exactly.
And then the opioids are just not working as effectively.
Yeah. Just like anything, your body gets used to it, so then you need more of it to achieve that same effect.
Third pain is neuropathic pain.
Right. And so this can be brought on by, well, obviously if the nerves are affected, then this is that pain. That sharp pain can be like tingling or electric or Sometimes just like a lack of sensation too can happen as well. Numbness, right.
Where I would assume that it's just so activated that it just starts to shut off.
Well, the numbness is actually the lack of the nerve firing at all.
Oh, it just
stops. Yeah.
And so that's no good.
Right. In general, it can happen if the nerve is compressed for too long because you'll have pain and pain and pain. It's trying to alert you, fix this, I'm stuck up, or I'm caught on something, or something's pushing on me, please help me with that. But if it's pressed on it too long, the nerve damage can get to the point where the signal just stops.
So is that like a subluxated vertebrae situation where it's the vertebrae is pushing on the nerve and it can just go numb after a while? Is that the same concept?
Right. With the spinal cord, there's these nerves that come off on either side, out the back through a little hole called the foramen. So based on certain movements that you do, you can either make that hole larger or smaller or something like that. There's different conditions like a herniation of the disc, or like if you've got arthritis in your spine that causes like stenosis that basically closes down on that space. Right. That can cause some compression of the nerve. But yes, if it's intermittent, that's a better sign that, there's something you can do about it, and that you need to probably address it at that moment, not just hope that it'll go away or get better or work itself out. A lot of times if it's compressed so long and then you lose sensation, then that nerve also, goes to muscles, and then those muscles aren't getting that signal either. Like imagine if the nerve is like a garden hose. If you're squeezing on that garden hose, there's not a lot of water getting through. So less water getting through, less signal getting through to the muscle. Maybe they are still working, but they're not working to their full potential. So they're not activating as well. So they start to, atrophy to the point where then they don't work. So it's just this whole, I know.
Very depressing.
Right. Wah, wah. But the big thing is that trying to address these things early on before it gets to that point. For most cases, this does not happen like overnight. It's just very rare instances where something can go from like 0 to 60 to some weird neurological conditions.
And as you get older, it's not like these conditions suddenly get better on their own.
Right.
I mean, it just can compile on itself as you age.
Yeah. But as a nerve heals, it's kind of interesting. It heals in reverse. So like if someone has a pinched nerve in their back and they have pain all the way down their leg and all the way to their toes, whenever you get that compression relieved a little bit, then I have patients that come in, they're like, you know what, my foot's feeling better, but my calf is killing me. Actually, that's a good thing because the symptoms are going to get closer and closer and closer to their back when that happens.
Really?
Yeah. And then same thing with like if it's been pinched so long and they have that numbness and they're like, you know what, it's not numb anymore, but it is killing. It's like hurts all the time. It's because that nerve is waking up again and healing, and the first sensation you're going to get back most of the time is pain.
So that's actually good pain.
It's actually good pain.
It's hard for us to know that.
Right. Yeah. So
that's why they need someone like you to tell them.
to explain, like, because sometimes they come in and they're a little angry with me. Yeah. And I'm like, this is actually what's happening.
I can understand.
Right. I mean, I would be too if I didn't know what was going on. It's like, what is this lady doing?
All this work and effort, and it's getting worse.
Right.
Yeah. Well, when most people think about pain, they think about nerves. And can you explain what nerves are and why stress can make pain worse?
Sure, yeah. So nerves are this pathway that your body is able to communicate with your brain and vice versa. Okay. Do you have nerves that go to all parts of your body? Let it be your skin, your muscles, or tendons, ligaments, bone, cartilage, organs, yeah, everything. It's just this really good communication system to, your central database, like your brain. So everything's getting on the same page. Nerves are very temperamental, though, so they don't like to be stretched because they're not really stretchy. They're not elastic. It's more like thread, if you think about that. Like
that doesn't stretch.
You can put it on slack, you can put it on tension. It basically has to glide past everything else in your body.
Interesting.
When you move.
Okay.
If there's an injury and there's these chemicals that build up in your system that activate those receptors, those chemical receptors in the nerve to give that communication in your brain, same kind of chemicals occur when you're stressed. So stress, again, going back to the caveman example, trying to survive.
Okay.
Way back whenever, like they're all sitting around the fire doing their thing, stress levels very low.
Okay.
All of a sudden there's an animal that starts chasing after them. Adrenaline goes up, all like stress levels go up, all these chemicals are released in order for them to outrun that predator. The predator goes away, they've outrun them. Congratulations.
Yay.
And then they get to rest. Those chemicals come back down. All right. We live in a society now where there's always deadlines and someone's always trying to get a hold of you, and we've got crazy schedules and we're going here, we're going there. But there's a lot of stress. We're always living at that peak of stress. Those chemicals are not dissipating out of our system.
Unless we have some sort of lifestyle thing that we do.
Right.
To purposely downregulate all that.
Yeah. There needs to be something that you always are trying to incorporate, either for yourself or just activity-wise, where you're just trying to bring that stress level down, where you're not thinking about work, you're not thinking about all these other things, like let it be exercise or meditation or something like that. You need to try to calm down the nervous system the best you can, because when those chemicals stay in your system, they irritate everything, and then everything starts to get tight, and you start to have pain for reasons that you wouldn't normally have them for.
And one of the things that I like to share with people is that stress was originally a mechanical term in physics that we've adopted for our bodies, which I think is a bit funny, but it's, it could be that external stressor that you're trying to create the homeostasis and balance within the body, or it could be even internal,
right?
Which could be pain, mechanical pain, or something, like what we've been talking about. So creating that balance. And I agree with you. In the kind of environments that we're living in now, I think we have to have active relaxation is what I call it. It means on purpose, doing it daily, doing it routinely, so that you know that it's going to happen.
Right.
Just to maintain balance, because when we're toxic over time and we just keep increasing those levels of toxicity, there's all sorts of illness and mental illness and all sorts of things that can happen.
Yeah. And I mean, you live with that higher level of stress, then all those nerves being activated all the time. Your nervous system is always in a fight or flight kind of response. So even if they have like back pain and they're trying to figure out what's going on, unless they can figure out how to calm down their nervous system and decrease their stress levels, like that is very, very hard to achieve, if not,
almost impossible.
I'm afraid to say impossible, but it's
almost impossible.
Right, almost impossible.
That's why we have to be, I think, so diligent. I mean, that's a funny term to use, but diligent about being relaxed.
Yes.
What are some behaviors that we can do to counteract the process that can cause pain?
So a big thing is just trying to decrease stressors in your life. Okay. So
don't work, don't have kids.
Right. Just be.
Just be.
Just be. Don't worry about your rent or your mortgage, or you'll just, so they'll let you know when they're taking your house. No, I'm just kidding. So calming your nervous system is the biggest thing. Laughter, what we're doing right now,
is very healing.
It's extremely healing.
Because you do release a lot of those good chemicals that can counteract stress, right?
Absolutely. Not only sense of humor and laughter, but obviously if you're going to have those things, you're going to be having like a better overall outlook on things, and being more positive about what's going on with you. It's whenever you get stuck in that negativity of, thinking like, oh, this isn't going to change. This is just who I am now. Like nobody can help me, like all this stuff. Then you start to feel helpless. That's a horrible thing too, because when you feel helpless, there is a sense of fear that happens. And then you're fearful. Your nervous system is going to be guarded, because it doesn't know what's going to happen next. It's in that fight or flight kind of thing.
And when you're in victim mode, it is super hard to reach out for help.
Absolutely.
It is super hard to be proactive about, okay, I'm going to make the appointment to go see my primary care physician, get a referral for a physical therapist, do the work.
Right.
because
Absolutely.
you just kind of shut down emotionally.
Right.
You get overwhelmed.
You get very overwhelmed because they just don't even know where to start. And it's easy for us to be like, why wouldn't you just go to the doctor? What would make their fear even worse is if they go and they're like, there's nothing we can do.
Well, strangely, I mean, I've even experienced that where professionals said, well, there isn't much you can do. And that wasn't true.
Yeah.
So even though you don't feel very good, but keeping an empowered mindset, I think, is so important that maybe you've tried one modality and it worked a little bit, but it didn't get to the root cause.
Right.
Keep trying.
Yeah.
It's worth it because more than likely you're going to find somebody who can help you in the right way.
Definitely.
And then you know that about your body for the rest of your life.
Right.
And can help other people.
And if you have pain and you can't get the answer, go get another opinion.
Always.
That's just one person's opinion.
And that's one modality's opinion, perhaps. Like,
Right,
let's say they're a chiropractor or a massage therapist. Well, maybe you haven't gotten a good opinion yet,
You
or an
haven't gone to
analysis
see
from a
physical therapist.
Don't give up.
Don't give up. And it's really, really hard not to. And that's why it's great to have a good support system around you to help out and to help push you, because there's going to be times where you're going to be really discouraged. If you have people around you that are, motivating you and being like, you know what, just stick with it. Or, have you tried talking to somebody else? Or here, I'll go with you. And,
or I'll help make the appointment with you.
Right.
Or
exactly.
I'll ask around and see if I can find someone that you could go to.
When is that aerobics class? I'll go with you to the first one.
I think that's awesome. We always fear the unknown.
Right,
even though the unknown might be exactly the solution that we need.
Right.
It just takes that little bravery to keep moving forward.
That little push.
Or maybe a big push.
Mild, moderate, or a large push.
Yeah.
Just depends. Yeah.
We're speaking of our support system, and do you have any suggestions on how to help a loved one with chronic pain?
Yeah. To help them figure out, first of all, why they're having the pain that they're having. Because once they figure out what that is, that itself is so empowering to understand and know exactly what's going on with your body and not have it be like this mystery.
Yeah.
I've had a ton of cases with patients where they come in and they have no idea what's going on and they're so frustrated. And I try to calmly explain everything. I use analogies. I've got diagrams, pictures, whatever it takes. I don't want anyone to leave my clinic and not have an understanding of exactly what's going on or why they're coming in to see me.
That's awesome.
And then the next visit they come back in and it's been like 2 days and they're like, I feel so much better.
That's so great.
Yes, I gave them exercises to work on, but did they really work that fast?
No. It's
all
the education.
It's the education.
It's that knowing that, it is something and there is relief.
Right.
There can be something that I can do to change it.
Right. Their fear level goes down because they understand what's happening.
So their stress goes down.
Stress goes down. Nervous system calms down.
Right. And that's a big part of it.
It's huge. My exercises do work sometimes, but not that well,
not
quick.
fast. In thinking about what a loved one could do to support the other person, like encouraging, self-care, talking about, hey, when is your next appointment? I'll go with you, all those things. Let's flip that.
Okay.
What should they not say?
Oh, get over it, or it'll work itself out, or you don't want to get better. Once they have pain for so long, it's really psychologically stressing for them.
Or I've been even told, well, you're just getting older. It's just part of life.
Right.
I refuse to accept that. I got a long way to go and I don't want to be in pain.
Right.
There's no reason to be. But,
right.
But I think maybe even generations back, that may have been a reality.
Right.
Maybe not even that long ago where we didn't have the kind of information that we have now.
Like the science just wasn't there to provide those explanations of why things were happening. Right. So then they didn't really understand it.
And again, that we've gotten more information in the last 20 years than in the previous 2000s. So for maybe our grandparents or grandparents, they didn't have a chiropractor down the road that they could go and get an adjustment with or a massage therapist.
Right. It was a much bigger deal. There was probably like one doctor for the whole county.
Most of us shouldn't have to just sit there and grin and bear it.
No, definitely not. Yeah. There's always something that you can do.
One of those things that we can do in practicing self-care in our lifestyle to help with chronic pain is foam rolling.
Yes.
Can you explain foam rolling?
Sure. Those byproducts getting built up in the areas, the lactic acid of accumulation from exercising. We have this stuff called fascia, this thin layer that's wrapped around all our different muscles, and everything kind of weaves in around everything. Sometimes that can get stuck or tight over certain areas. And when that happens, that can cause some irritation, which causes the inflammation and all that other stuff. So foam rolling is a really good tool that I think people...
Do you have one to show
I
the
do.
audience? I know not everyone is watching this,
Right. So this is a foam roller.
And this is about for people who can't see.
So that's probably about 1.5 feet.
Okay.
So you could get one that's like 36 inches long too, so double this length. Basically, you can use this to foam roll any muscle area on your body, essentially. That creates that muscle pumping or that massage.
So it's literally laying down on the floor. Here's the floor, and then you've got the foam roller, and then you're rolling your body.
Yeah, you're rolling your body right on top of it. A lot of times people will use them for their legs because those are really big muscles that a lot of stuff kind of settles into them. I like to always do this after I exercise because that helps to try to massage everything out. You might not even be sore the next day because you foam rolled after you exercise.
Doing along the spine too, all the way from the tailbone up to the
That's going to help. That's going to help a lot with spinal mobility and just make sure all of those segments are moving the way they're supposed to, and not any are like getting locked down in place and causing compensation of other levels above or below. So I think foam rolling is really great.
And they have different strengths too. Some are softer than others.
Yeah, so this one's pretty soft. So if I can push into it, my thumb kind of sinks in a little bit here. But some of them are a little bit more firm. Some of them have like these crazy bumps all over them, and that's kind of...
Seen that.
Yeah.
Is that better or worse?
You know, I think it's better to just go with a flat one.
Do you have any opinions about yoga?
I have a lot of patients that have done yoga and they love it, and there's a lot of benefits for it. But, you know, it's not always for everybody. So you always have to gauge that for yourself. Just like any exercise isn't always for everybody. If there was, there would just be one form of exercise and everyone did it. Yeah. So then they try to go and do the same motion as everyone else, and then they're not trusting their body. A good rule of thumb is if it hurts,
don't do it.
Your body's trying to tell you something. Yeah.
We're so individual, and we have to honor our own body's limitations. And my personal philosophy about yoga is shouldn't go into it and cause pain. And I teach a yoga class as well, and that's what I tell all my students. If it hurts, stop doing it.
Yeah.
We're not here to move through the pain. Like that's not, especially because I
teach.
No
pain, no gain.
There's so many different forms of yoga. There's more of an entry-level hatha yoga or yin yoga like I teach. And having an injury, especially being new to yoga or not having done it in a while, doing something like an Ashtanga practice or a vinyasa practice is probably not good.
Right. I mean, it's like saying that you want to pick up running and then you go and run 10 miles.
Yeah.
It's not a good plan. You have to ramp up a little bit.
And talk to the instructor. Make sure that you get there, I think, early enough to be able to just tell them what the problem is and that you need modification. So if you don't want to say that in the middle of class, then they know, which is all back to empowerment. Right. Just stating where you are and what you need.
Right.
Being an advocate for yourself.
Absolutely. It's been really awesome discussing this with you. And I'm
so
really
glad
that you asked me to come and talk.
I so appreciate it. Yeah. Thank you so much.
Yeah, definitely.
Speaking of reducing pain, an effective supplement is CBD. Our featured product is Wabe's CBD oil. It doesn't contain THC. That means it's safe and it's legal. Studies have shown that CBD oil may help reduce pain and inflammation. Researchers have even found that it's been most effective in people who suffer from conditions like arthritis and MS. Go to yourtruthrevealed.com/store. After watching this episode, how have you healed from chronic pain? Please post your answer in the comments below and check out some great resources in the description. And for more learning, Download your free worksheet on my website, yourtruthrevealed.com. Make sure you subscribe and click the bell to be the first to know about upcoming episodes. Make sure you tune in to episode 15, Know Your Mental Health with Roger Walk.
Mommy's believes that 1 in 5 people either have a mental health condition that is treatable or are in a family who are directly involved.
I'm Erika Marcoux. Thank you for watching.